So in the last panel, which was fabulous, by the way, we heard a great summary about the breadth of what the Nantucket Project has called the social media emergency, from genocide in Myanmar to religious communities torn apart in the United States. Now, as Alex mentioned, we're going to get a little more granular and dig into two areas where social media has had an acute and profound impact, and that's public health and human trafficking. First, let me introduce our great panelists. I'll be brief with their bios, but let me tell you, they have long and very impressive lists of accolades, so I would encourage everyone to check it out. So first, Dr. Craig Spencer is the current Director of Global Health and Emergency Medicine at New York Presbyterian Columbia University Medical Center. So a long title, but he also serves as the Board of Directors for Doctors Without Borders. Joelle Bervell is a medical student and social media medical influencer who discusses and combats misinformation about medicine and racial health disparities on TikTok and Instagram. Anjana Rajan is the former Chief Technology Officer of Polaris, one of the largest anti-human trafficking NGOs in the United States, and she's currently an entrepreneur in residence at Cornell Tech. And lastly, Ambassador Coppedge is the Executive Director of the Georgia Legal Services Program. She previously served as the U.S. Ambassador at Large for the Office to Monitor and Combat Trafficking in Persons. So I want to start a little broad and ask Ambassador, how has social media impacted the work that you've done for a long time in combating human trafficking? What are the broad impacts that it's had in that space?
Thank you. It's really nice to be here today. Thank you so much, Alex, for having me. And Majority Leader, putting your heft and gravitas behind this is so important, because I talk about change comes when the corner office cares about what we're doing. So thank you so much. I'm going to date myself here by saying I was a former federal prosecutor. And when I started trying trafficking cases, the recruitment and exploitation of individuals occurred on the street. So my first case involved traffickers that people used to call pimps, trafficking over 45 juvenile girls in Atlanta. And they found all of these girls on the street. They were runaways. They had difficult home lives. Now a trafficker can sit in his or her home and find these people online. So the recruitment has basically all gone online. And there's targeted recruiting that we call hunting a specific individual. And then there's phishing, which I'm sure we've all been victims of on some level, maybe not on the trafficking level, where a trafficker throws his net of deceit and false hope widely and hopes to catch those that are vulnerable to trafficking. So it's really, social media has changed the landscape. And I'm not going to make you all trafficking experts today, unless you want to sit next to me at lunch. I'll be happy to. But IOM, IOL, and Walk Free estimate that there are 27.6 million people being trafficked globally. And we think a lot at first, initially, about sex trafficking, but there's also labor trafficking. So trafficking is anything you're compelled to do by force, fraud, or coercion, essentially that you don't want to do, that someone else is commercially benefiting from. And so that's going on online. It doesn't require transnational movement. And so that's what we're facing today. And the other end of that statistic, I'm a lawyer, so I like to cheat when I look at my numbers and be really accurate, is that Meta in 2021 reported 26.8 million potential child sexual abuse materials to the National Center for Missing and Exploited Children. So that's what we require them to do right now under the law, is report potential. I think we should require them to prevent trafficking in the first place.
Thank you. So Dr. Spencer, similarly, how has social media changed your work on the front lines of public health?
Yeah, so I've worked as an emergency physician in the US. I've worked internationally in disease outbreaks. I think everyone knows that the number of public health professionals and amateur epidemiologists has increased by like 10,000% over the past couple of years. Look, I know that we're here today to talk about a lot of the potential ills and the fixes for social media. And within the realm of public health, I can say that there sure is a lot of reason to be disheartened. But social media has been incredibly important. If we think back to March 2020, for example, at the end of just a normal day for me going to work, I took 15 to 20 minutes, drank a little whiskey, wrote a maybe 10 tweet thread, and just sent it out to the ether. I had maybe a couple thousand followers at the time. And within 24 to 48 hours, it had been retweeted by President Obama. It had been seen by over tens of millions of people. And I didn't recognize why this would resonate because I was just going to work. But this was a time when people were hearing different things, trying to understand what was actually happening and how to protect themselves and their family. And what I could share from seeing patients in the emergency room and what had concerned me from the dramatic uptick I'd seen in COVID cases and deaths was helpful. This probably will surprise many folks, but most of the advice and kind of the technical decisions around how to manage COVID that we learned in March and in April of 2020 were not in peer-reviewed journals. They were in my Twitter DMs. I connected with people from all over the world sharing advice. Hey, this is what we're doing. This is how we're turning people over. This is how we're managing folks like this. And we're seeing good outcomes here. And a lot of that coalesced into broader coalitions that went, onto different platforms and went onto WhatsApp, went on to write, big papers or do things to try to inform the public health response. But it all got started in place like my Twitter DMs. Now, it's easy to say that, and it's easy to paint a rosy picture, but clearly anyone that has been following on any social media platform over the past couple of years has recognized that public health has taken a beating. A lot of this is a crisis of confidence in what public health professionals have been able to do. Some of that is of our own making with miscommunication and missteps by some of our trusted institutions. But a lot of this is because, as others way smarter than me today have said, these platforms have prioritized and really magnified things like the video pandemic, which was seen tens of millions of times, and dramatically impacted people's perceptions of our public health authorities. And the result is that right now, we have many folks who, I saw a tweet the other day that said, if you've learned anything over the past couple of years, it's this: from an emergency physician, do your own research. Now, I will tell you, as an emergency doctor and as someone that worked in Ebola in West Africa, in hepatitis E in Chad, all over the world, you should do your own research, but you should also listen to the advice of professionals. And that, unfortunately, dry, basic communication, the way that we've been trying as public health professionals to communicate with the public has failed. And so it's not just the problem of social media, it's the problem of traditional and long trusted, but now conflicted and confused institutions where social media is giving a place to people who, push unproven medications, who fight over, trivial things that get amplified and make it that much harder for physicians, people on the front line, public health professionals to do their job. And that's only led to even more mistrust. Right now, there are dozens of states in this country that have restricted the power of public health officials. If you talk to any single person who knows anything about pandemic preparedness, they will all tell you universally that we are less prepared for the next pandemic today than we were 2 years ago. And the restrictions on public health, the lack of trust, largely fomented by social media, is going to make it that much harder to do our job.
So I guess I want to turn to you then, Joelle, since you're somebody who has really found a voice and an audience on social media. How do you balance the sort of power that it has to empower individuals with the sort of negativity and the negative outcomes that can come from the spread of conspiracy theories, misinformation, disinformation?
Absolutely. Well, first of all, thank you so much for having me here. I want to ask a question. How many people here are on TikTok? Raise your hand. Interesting. I see 4 hands in the audience right now. How many people are on Instagram? Okay, a little bit more. Twitter. So most people. Okay. Snapchat. 4 people. Okay. Interesting. I asked that because I think a lot of times when we talk about these things, we don't think about it from what does it feel like to actually consume this media? What does it feel like to be in this space? And being a part of this like Gen Z millennial life, I'm a zillennial, it's like right in between. I think a lot about social media. I grew up on this. I was using it every single day of my life. And now I'm actually creating content as well. So what I do online is I use social media to talk about healthcare disparities, health inequities that exist. And I started in 2020 when COVID started because a lot of people were asking me questions about COVID. I became a trusted source. And literally within 2 years, I've built up a following of over 500,000 on TikTok and over 100,000 on Instagram. over 100 million views on my videos all over. But with that, I think a lot about how is it possible that someone like myself, who just started posting a video, could have that much influence, where I now work with the White House talking about social media and healthcare influencers. And I think it comes with dangers where there's an ability for people to build a platform and spread misinformation, especially when it comes to healthcare or different ways to take care of yourself and your family and loved ones. And there's no kind of ramifications for if you put out incorrect information about that. I think social media sites have started to look into what they can do. Instagram putting on a CDC kind of caption overlaying when you talk about something like COVID. But there's a lot of balance that has to come with putting out information that's accurate as someone that's still going through the medical field, and realizing that a lot of people who have no understanding of how to look through a peer-reviewed research article and figure out what's that N number, is it actually something that makes sense? Is this something, what were the funders and who were the researchers behind it that were putting the study out there? When we don't have people understanding how to do that research, but are putting that information out there, that leads to more of these mistrust and distrust of the systems that we have right now. So personally for me, what I try and do is attack those people head on. When someone comes up with a study and they say, I've seen this study that says X, Y, and Z, ivermectin can be used to treat COVID. Finding out where the resources are coming from, where people are getting that understanding, and trying to walk people through the tools that are needed to actually understand a piece of literature. I think one of the biggest things that we can be doing in our country right now is teaching digital literacy to students coming up. I think the things we learn in medical school about how you go through and actually research and find out information about what's accurate, what's inaccurate, needs to be taught at a younger age to elementary school students, so they understand, how do I parse out information that's true or false for myself?
So Anjana, I saw you nodding along to what Joel was saying. What are the ways in which these same kind of problems, disinformation, misinformation, have impacted your work in the trafficking space, whether at Polaris or since?
Yeah, it's wonderful to be here. It's great to be with you, Susan, who sits on the Polaris board, and we've been so lucky to learn from her expertise. I was new to the human trafficking movement. I'm an engineer. I'm a cryptographer by training. Worked in national security, and when I think about Polaris's decision to hire their first CTO, it was actually quite progressive to do that, because they understood that the landscape in which the economy of trafficking happens on the internet economy. When I think about our work on mis and disinformation, I absolutely agree. I think technology, conspiracy theories are not a new phenomenon, but technology is absolutely a force multiplier, both in the velocity of which it spreads and the magnitude of the harm. And from my vantage point, I can kind of map out the role of technology in human trafficking disinformation in 3 distinct phases. And so the first phase really kind of goes back before I joined Polaris, going back to Pizzagate. And those of you who remember Pizzagate, it was a conspiracy that accused Hillary Clinton and the Democratic Party of running a global pedophile ring, performing satanic rituals, drinking the blood of children. And they were convinced that this pizza shop in DC was the headquarters for this cabal. And this conversation was manifesting online on 4chan, and it was so believable that it motivated a man named Edgar Madison Welch to take an AR-15 and go to Comet Ping Pong with the attempt of starting a mass shooting in the name of rescuing children. What I think is really fascinating to me is that most people did not take this seriously. I remember this being like the butt of the jokes on late night TV, but you know who did take it seriously? Alex Jones. He then pushed this narrative out. And then QAnon, which was then created a year later, who saw how sticky and believable this narrative was, and then used it to build their following. And so a year later, in 2018, after QAnon had been around for about a year, they used that narrative to attack Polaris, and began a narrative that Polaris, which operates the U.S. National Human Trafficking Hotline, was not actually a crisis hotline, but really just a recruiting funnel for Hillary Clinton. And on August 2018, Q dropped a Q drop that targeted Polaris and mobilized his army of followers to attack Polaris with 2 goals. The first goal was to inundate hotline advocates with threats of violence. But more importantly, how can they block the hotline and clog the hotline with calls so that no one can get through. And so we got 7,000 calls to the hotline in a 12-hour period. So what I'm describing is not just an attack on a nonprofit, but it is a cybersecurity attack on government-funded critical public infrastructure. And that was driven by disinformation on the internet back in 2018, before QAnon was a household name. So when I joined 2 years later and was hearing about this, that was when we were entering into phase 2. And that was really going from this fringe online, community to a mainstream phenomenon. And there's no example that better illustrates this than the Wayfair conspiracy theory of the summer of 2020. And what the Wayfair conspiracy said, again, driven by QAnon, argued that Wayfair was actually shipping children to pedophiles in their cabinets. And this was part of this broader corporate complicity narrative that was really sticky. And what was fascinating was that this now moved from these fringe online communities on 4chan and 8chan, but now onto Reddit and Facebook. And what happened was we saw the shift from disinformation, which is malicious intent, to misinformation, which is not malicious intent. And what ended up happening is now you've got, soccer moms from Ohio calling the US National Human Trafficking Hotline, telling us, hey, go get those pedophiles at Wayfair, thinking they're doing something with altruism. And what ended up happening is when you call the National Human Trafficking Hotline and report a crime against a child, well, we're mandated reporters, which means that we now have to call law enforcement. So the entire apparatus was destroyed by one conspiracy theory. To put some numbers behind it, a typical call to the hotline is about 2.5 calls. We got 536 calls about the Wayfair conspiracy, which could have instead been used to help 42 trafficking victims. And so when you think about the compounding effect of one conspiracy theory, there's a real human cost to that. And so now we're entering into the third phase, which is watching very sophisticated malicious actors use these narratives as gateway narratives to achieve a broader, more insidious political goal. And that, again, became very clear on January 6th, 2021. And what we saw kind of coming out between the Wayfair conspiracy and January 6th was a political climate that was incredibly fraught. We had a COVID pandemic, the murder of George Floyd, a presidential election that was very tumultuous. And we saw narratives morphing together that was taking hashtag Save the Children, which, by the way, is an actual nonprofit. So we saw, bad actors hide behind legitimate human trafficking narratives, morphing with narratives around a stolen election. And what we ended up seeing on January 6th was that two of the women who died that day, Ashley Babbitt and Roseanne Boyland, were specifically there because they believed that they were rescuing children from the Democratic Party. And when we looked at their social media, what was particularly haunting was that Roseanne Boyland was radicalized so quickly. It was the Wayfair conspiracy from earlier, a few months prior, that drove her to the Capitol. And so when we think about that speed from that first indoctrination to a conspiracy theory to committing an act of violence against your own country, it is incredibly fast, it is incredibly dangerous. And that not only poses a human rights risk, but it also poses a national security threat.
Can I add something that just connects Anjana and Susan's world with ours? It's easy to listen to those and think Pizzagate or shipping kids in, Wayfair cabinets that I don't think come pre-assembled anyways. It just sounds crazy, right? And conspirational, and none of us would fall for that. But I remember in June 2020, working in the emergency room, and one of my friends, a colleague, coming up to me who had worked with me in March and April 2020, helped me turn off ventilators for patients who were dying or had died, had witnessed everything that we saw in COVID, and came up to me and said, Craig, a good friend of mine just sent me the cure for COVID on Facebook. And I chuckled because I was, well, clearly that's not true. I thought he was joking. And he was very serious and, continued for 5 to 10 minutes to talk about it and everything behind it and how he just needs investors for him and his friend to push it. And this is someone that is very educated, saw the impact, should know that of course is not true. But I think the point is that it's easy to think about this as a fringe or conspirational issue when its impact is so omnipresent and so powerful that any and all of us could be swept up within this.
And just to follow up really quickly to that, I think, especially in a field like medicine, where the majority of people don't know their own health, it is so much easier to get swept up into these things, to not know where the trusted sources are, to not know where to go to. I think there's been this shift from trusting the public, trusting like government institutions overall to public figures who now have platforms. And the power shifted a lot. And I think because of that, we need to have more of an understanding of how are social media companies going to do a better job of making sure those people who have platforms that can push out information that previously was in trusted institutions can now make sure that they're actually empowering the right people. Maybe even, I mean, my dream would be to switch over the way the algorithm works from clicks to trusted information. What would it look like to have a platform that pushes out information that's correct over information that gets more clicks, you know, especially when it comes to specific fields like medicine?
Yeah. So you prefaced my last question perfectly, and we only have a minute or two left, but I just wanted to ask to Max's point about friction. What else can the platforms be doing to add friction to the spread of misinformation, conspiracy theories in the world of human trafficking and public health?
So I've already kind of hinted that traffickers trade in lies and deceit, and they're going after the most vulnerable. And so they're selling a dream. And one of the most common dreams is you can be a model, you can have a party lifestyle, you can travel the US and make lots of money. How hard would it be to throw up a pop-up that says, most legitimate modeling jobs don't happen online, right? You should consider before you send anyone pictures of yourself that you would not, you know, want the public to see. Things like that, things that would just pause. And it's children who are mainly being preyed on, but all of us have a naivete in some area. We're not all experts in some area. So we're all susceptible to falling for some hook. And people get embarrassed when a fraudster takes advantage of them and they don't want to come forward. But I always would back my juries up to when they were 16 or 17. And I bet you can think of something. It might be more challenging for some of you to go back that far, but I bet you can think of something that you did that you wouldn't want the world to know you did at that age. I will out myself. I was 17 at a beach trip for my high school graduation, and we had to run the dishwasher to leave the condo. We didn't have any dishwasher detergent. So I put in dish liquid soap because I didn't know any better. Has anybody done that? Oh, good. Other people did that same stupid thing. And it just foams and foams and all the soap comes flowing out. That's just like, and I can talk about that. What if what you did was something that was sexually provocative or promiscuous? And then the person that you sent that picture to is now threatening to share it with everyone. Could you come forward and tell people? No. But if you got a little pop-up from the platform before you sent something, or that was keying off on the word models, which is, you know, they can't really change that word if they're what they're trying to recruit are young girls who want to be models. Like, I think the platform could throw up some friction there.
I know we're here to talk about social media platforms, but I think it's important to remind ourselves that slavery, genocide, propaganda were not invented by the internet. These are problems and societal ills that are quite literally biblical, that have been around since the beginning of time. And they're fundamentally about the abuse of power. So as we talk about solutions over these next few hours and hopefully in a few months and years, I think if we remind ourselves that we are looking to see where will bad actors, both domestic and foreign, find ways to abuse economic, social, and political power, and then design upwards. And that may happen on social media platforms, but it's also going to happen offline. It's going to also happen in other forums. And I think that is the framework in which we need to think about solutions, both on the engineering side and on the regulatory side.
I think for me, I've said it before, but I think creating a more digitally savvy upbringing for children in schools. Social media, unfortunately, is not going away, or fortunately, unfortunately, however you want to look at it. And so I think creating tools and the ability for people to understand how to use it, like any tool we do, I think that's the best way we go forward.
I'm just a doctor, so I fix the problem. What I will say is that, you know, social media is not alone in being an issue, right? It's not like social media is the only divisive part of our society. It is also our traditional media and traditional institutions. The greatest predictor of whether you will die of COVID today is how you voted in the last election. And a lot of that is based on directly the news that you watch. Like, this is not me pontificating. There have been actual studies looking at what you watch determines whether or not you have a high risk of dying from COVID today. COVID, a disease that has killed more American lives than nearly the sum total of all American lives lost in war since the founding of our country. And we still can't convince people to get vaccinated. We still can't get trusted information to folks. And it's not just social media that's the problem. It's our larger media and trust in larger institutions that I think are fomented by and unfortunately contribute to this cycle.
Thanks, everyone. This was a great panel.